in terms of the use of antipsychotic drugs and the troubling rise this report shows, how are you? I guess I'm curious how you might ask the government or the provincial health officer to move forward with increasing transparency and, I guess, rights of families to prevent that sort of intervention with their loved ones. Just because I'm quite surprised at that jump when families aren't necessarily there to, act as a more social means of calming someone's mood.
Well, I think that's sort of the basis of the third recommendation, which is to create a provincial association of family and resident councils. We've got to find a way to get the voice, a collective voice of residents and family at the table. Over this pandemic, there has been a lot of consultation and a lot of focus on long-term care. The government cannot be faulted for that. This is not because they don't care. But at the table are the industry associations that represent the care home operators and the health authorities that operate the care homes, and you have the unions and the safety associations for the employees. There's nobody there for the residents and the family members because there's no collective voice out there. There's no association that the government can go to and say, tell us your perspective on this. And we need that. We needed that way before this. And that's a whole other story for another day. But now we really need to move forward with that. And this demonstrates the frustration that these families feel and that these residents feel over not being heard is almost as difficult and traumatic as the separation from their family members. They feel absolutely powerless because they feel they're not being listened to. I don't think that's true, but I think that they feel that way because there's no effective way to harness their voice.
Next question is from Mike Hager, Globe and Mail.
Hi, Isobel. Thanks again for this survey and the findings. Going back to the medication of residents, do you have a baseline prescription rate? I know that perhaps a decade ago, about a half of residents in long-term care were prescribed antidepressants. Can you talk about those other psychotropic prescriptions and whether those have also seen a rise since the pandemic touched down in the sector in March?
Yes, we have. We've seen an increase in antidepressants as well. It's not as dramatic. It's a 3% increase. We haven't identified antidepressants as, the use, I should say, of antidepressants as a quality indicator to the degree we have antipsychotics. I know that if we look back 10 years ago, we made a concerted effort to focus on reducing the use of antipsychotics in long-term care for a whole host of reasons. They are very, very powerful drugs. And we made a lot of success here in BC. We aren't as successful, frankly, as some other provinces like Ontario and Quebec, but we did decrease our use of antipsychotics, and we were very pleased to see that. These last 7 months have basically wiped out all those gains of the last 4 years of efforts to reduce antipsychotic use in long-term care. So we are really, I am really concerned about that one. And then I am very much waiting to hear what the Q2 clinical assessments are when they come in. We've heard residents, they're not clinical assessments, but residents have said, over half of them have identified that their loved one is worse now than they were before. Some of that is a natural process. In a given, what we would call a quarter, in a given 3-month period, we would see about 25% of residents experience some of these worsenings. But residents are reporting it's half, so that's double.
Do you have a follow-up, Mike?
Yes, apologize, it's double-barreled, but is the nature of the infrastructure here in BC contributing to the rise in antipsychotics? You said that Ontario does it better. Are they helped by more residents being bunked with other residents within a room? So shared accommodation, is that helping people kind of weather that storm further east? And, people living in single suites, do you think that's contributing to the rise in antipsychotic use, that extra isolation? And as well, the family councils, was that not legislated at facilities that receive government funding? Would it not be an easier fix to, if it's not legislated, to mandate that every long-term care facility have a family council that has a seat at the decision-making table?
So the first question, Mike, around the antipsychotics, my comment about our experience relative to Alberta and Ontario is pre-COVID. I don't know what the antipsychotic use is in Ontario at the moment. This is from our prescribing data, and I don't have access to Ontario's prescribing data. So I think that actually overall in long-term care, we've managed things better than Ontario has. And I think that that's not a subjective opinion. I think if you look at some objective indicators around how many care homes experienced outbreaks, how many spread, resident infections, et cetera, I think you will find that we've done better. There are many reasons for that. There's not a single reason, there's many reasons, but we have done better. I think in terms of the family councils are not regulated or legislated currently in BC. They are referenced, and care homes are encouraged, for want of a better term, to have them, and many care homes do have family councils. There is a move that we should be regulating or embedding in regulation or legislation that there must be, and that the other issue is that the current way we have resident and family councils is the only relationship is with the management of that care home. So if I'm on the family council in my dad's care home, I'm really just talking to the care home operator about there's no mechanism that the health authority can know what's happening, or that the province can. We need to knit that together and bring a collective voice and experience up to the health authority level and then the provincial level with our resident and family councils. And I think as we do that, they'll be strengthened across the board, because they'll have the type of voice and leadership that they need to be at the decision-making table.
I am just looking for clarification then. We were looking at this, and again, it goes back to this 7% rate increase in the use of antipsychotics. So just to clarify, this is what families are reporting. Is that accurate?
No, this is actually our prescribing data. So one of the ways that we look at the use of antipsychotic is we use what we call our inter-eye assessments, but they are only done every quarterly. We only have Q1 data. This is telling us how many unique people in long-term care are being prescribed antipsychotics, and that rate has increased. So this is objective, not observational. Data out of PharmaNet, out of, I think, the Plan B. I should qualify that this represents 2/3 of care homes. Community, CCALA, Community Care Assisted Living Act sites. Those that are under the Hospital Act site have a different PharmaNet or pharmaceutical regime, drug plan, I think is the way we say it, and we can't tease that data out. But this is as I say, a little over 2/3 of our sites. So it's a pronounced pattern.
Do you have a follow-up, Michelle?
Yes, again, just a clarification. So then when you're talking about this worsening of condition in about 25% of residents, is that based on the criteria that is being observed in the homes, and then families are seeing in addition to that, or is that just what you would generally see?
That's what you would generally see. So what we know is that about 50% of families reported that when they saw their loved one again after the first phase, so after about 3 or 4 months, Over half of them said, yes, their physical condition is worse, their cognitive condition is worse, and their emotional well-being is worse. In the normal course of events, if we look in previous years, in a quarter, 3-month period of time, we would generally find that about 25% of our residents would present with demonstrably or markedly worse conditions around physical function, cognitive function, and emotional well-being. So it's that comparison. We will know more on this when we get the Q2 data out of our clinical assessments. We won't have that until the end of November, beginning of September. And I think we really will know what the story is when we get our Q3 when we get our Q3 data as well. But I hope that answered the question.